Hi, I am Dr. Lokesh HM, surgical gastroenterologist at Narayana Hospital, Mysore. Today we will talk about colon cancers. Colon cancers means the tumor which are arising from the large intestine. So large intestine will contain an ascending colon, transverse colon and the descending colon and sigmoid colon. These are the parts of large intestine, and also large intestine is also called as colon. The tumors which are arising out of these colons are called as colon cancers. So usually the surgery is the treatment for the colon cancers. Colon cancer patients usually present as an unexplained weight loss, reduced appetite or an unexplained anemia. So these patients are usually diagnosed by colonoscopy. So colonoscopy means the endoscope which are passed from the anal canal, which sees inside the colon the mucosal pattern and any ulcers or any tumors or any polyps which are present in the colon, so that you can take a bit of the tumor, and then that biopsy will give us whether it's a tumor or the malignant tumor or in just a polyp or in just a small ulcer. So these patients can be diagnosed with a colonoscopy. Again, the staging for these patients will be done by a CT scan of the abdomen, contrast enhanced CT scan of the abdomen. That gives whether the tumor is limited to the colon or to only to the lymph nodes, or it has spread across beyond the colon to the liver or into the peritoneum, so that we can treat accordingly. Once the staging is done, well, if it's a local disease, then the surgery is the mainstay of treatment. Here the surgery means the removal of colon and the lymph nodes is very important. After removal of the colon will again joined, so that patient will have a normal stool passage from the anal canal. The lymph node removal is very important again here. So if you remove the lymph nodes properly, the chances of coming back will be very less. The lymph node dissection is very important, and minimum of 15 lymph nodes has to be isolated or dissected from the patient, so that they will have a proper staging of the colon cancer. So once we do the surgery, and that specimen will be sent for histopathology, and that will give the proper staging of the tumor. So that stage will decide whether the patient requires a chemotherapy or not. So if the lymph nodes are positive, usually chemotherapy is required. If you don't remove the lymph nodes, then your staging will be understaged. So, means the staging, the lymph nodes are positive, but you feel the report comes as negative. So then patient will not get the chemotherapy, and they will have a recurrence within few months to few years. So that time again the treatment or the cure is very difficult. So it's very important to remove the lymph nodes also. Again, the surgery is usually done by open method, but a laparoscopic method is also available, and it can be easily done as in our department. Usually advanced laparoscopic surgeries are done. So this surgery is also done in the laparoscopic method, so that these patients will get a benefit of minimal access surgery. Colon cancer patients needs a proper follow-up, so that even when they have a recurrence, so the treatment or the cure is still possible. It's unlike any other digestive cancers. The colon cancer behave very well, and if we diagnose the recurrence early, the treatment or the cure is possible.